Welcome to the Getting Healthier Together module on high blood pressure. This video can help you understand what high blood pressure is, know who is at risk for high blood pressure, find out how sodium and salt can affect high blood pressure, know what medicines are commonly prescribed for high blood pressure, and create an action plan for yourself. What is high blood pressure? High blood pressure is one of the most common health problems that healthcare providers diagnose. Blood pressure is the force of your blood pushing against the walls of the blood vessels that run through your body. It's actually two forces. One is the force caused by your heart as it pumps blood through your body, and the other force comes from your blood vessels as they resist the blood pumped by your heart.
Blood pressure is written as two numbers. For example, 118, a slash, then 78. You might hear your healthcare provider say a blood pressure is 118 over 78.
The first number is the systolic measure, which is the pressure when your heart contracts or squeezes. The second number is the diastolic measure, which is the pressure when your heart relaxes between beats. If your numbers are 140 over 90 or more, you have high blood pressure. There's a medical term for high blood pressure. Do you know what it is? Is it hypotension, hypertension, or is it hypoglycemia? If your answer is hypertension, you're right. The medical term for high blood pressure is hypertension. Some people have a condition called prehypertension. That means that their blood pressure is more than 120 over 80, but less than 140 over 90. Now that you know the technical meaning of high blood pressure, please join us for part 2, where we'll talk about what factors may put some people at more risk for having high blood pressure. Who is at risk for high blood pressure, and do we have control over these risks? According to the American Heart Association, you can lower your risk for high blood pressure, but some risk factors can't be controlled. A risk is a factor that's linked with a higher chance for something happening. For example, a risk might give a person more of a chance for developing a disease or an infection. The risks for high blood pressure that you can't control are race, heredity, and age.
High blood pressure tends to occur more often and earlier and be worse for African Americans and people of Hispanic descent.
If your parents have high blood pressure, you are likely to have it too. And the older you get, the greater the risk for high blood pressure. Here's a list of some more risk factors for high blood pressure. The list includes weighing too much, eating too much salt, drinking too much alcohol,
getting too little physical activity, smoking, having high cholesterol, and having too much stress.
Please look at this list and then see how you'd answer this question. Which of these risk factors are under your control? If you like, pause this video briefly as you take a moment to think about your answer. The good news is that all of the risk factors for high blood pressure listed here can be controlled by you. When you know what the risk factors are, you're in a great position to make choices that can help you avoid or control high blood pressure. In part 3, we'll talk about what sodium and salt have to do with high blood pressure. What do sodium and salt have to do with high blood pressure? Eating less salt and sodium can help you prevent high blood pressure or lower blood pressure. Most people know what salt is, and some people use the words salt and sodium as if they're the same thing. Actually, sodium is one part of salt, and it's also used to add flavor and preserve foods. You get sodium from your salt shaker, of course, and from many processed foods. But do you think there's also sodium in natural foods? If you think there is, you're right. Even fresh vegetables have sodium. but very little compared to many processed foods. Here's another question for you. How much sodium do you suppose our bodies need every day? 500 milligrams? 1,000 milligrams? At least 3,000 milligrams? The correct answer is that we need around 500 milligrams of sodium each day.
That's a little more than a half teaspoon.
Most people have much more than 500 milligrams of sodium every day. The advice is to limit the amount of sodium you get from all foods and beverages to less than 2,300 milligrams of sodium,
or a little more than a half teaspoon of salt a day.
And some people may need to limit their sodium intake to less than 1,500 milligrams per day. If your healthcare professional has asked you to consider eating less sodium, or you're trying to reduce your risks of high blood pressure, there are lots of tips for making things easier. For example, buy fresh, frozen, or no salt added canned vegetables. Choose food that's packed in water instead of broth or salt. Buy fresh garlic or garlic powder instead of garlic salt. Choose foods with labels that say low sodium, sodium free, or no salt added. Start cutting back on the amount of salt you add while cooking slowly until you're not adding any. Add just a little or no salt at all to the water when you cook beans, rice, pasta, and vegetables. Rinse all products that come from a can. Fill the salt shaker with a mixture of herbs and spices. Slowly cut back on the amount of salt you add at the table, or just take the salt shaker off the table.
Choose fruits and vegetables instead of salty foods like chips, fries, and pizza.
There's a handout available to you called Tips to Reduce the Use of Sodium. It has some reminders about what we've just talked about. In Part 4, we'll be talking about medicines for treating high blood pressure. What medicines are typically prescribed to help control high blood pressure? There are different types of medicines. A person who has high blood pressure may be taking one medicine or several, so it's important to talk with a healthcare provider or pharmacist to understand exactly what the medicine is supposed to do. Here are some examples of medications used to control high blood pressure. These descriptions have been adapted from the NHLBI, which is the National Heart, Lung, and Blood Institute. Diuretics are sometimes called water pills because they work in the kidney and flush excess water and sodium from the body through urine. Beta blockers reduce nerve impulses to the heart and blood vessels. This makes the heart beat less often and with less force. Blood pressure drops and the heart works less hard. Angiotensin-converting enzyme inhibitors prevent the formation of a hormone called angiotensin II, which normally causes blood vessels to narrow. The blood vessels relax and pressure goes down. Direct renin inhibitors prevent the formation of angiotensin I and II. These help blood vessels relax and widen so blood pressure is lowered.
Angiotensin II receptor blockers shield blood vessels from angiotensin II.
As a result, the blood vessels open wider and pressure goes down. Calcium channel blockers keep calcium from entering the muscle cells of the heart and blood vessels. Blood vessels relax and pressure goes down. Alpha blockers reduce nerve impulses to blood vessels, allowing blood to pass more easily. Alpha-beta blockers work the same way as alpha blockers, but also slow the heartbeat, as beta blockers do. Nervous system inhibitors relax blood vessels by controlling nerve impulses. And vasodilators directly open blood vessels by relaxing the muscles in the vessel walls. There's no need to memorize any of this information. The main point is that if you're taking medicine, you shouldn't hesitate to ask your healthcare provider or pharmacist for more information so you can be in control. One of the best ways to be sure you're in control of any medicines you've been prescribed is to fill out a personal medication log. There's a medication log handout that's available to you, and it looks like this. If you want, pause the video now if you want to find your copy of the handout and follow along. The idea is to write the name of each medicine in a separate line. Then, for each medicine, describe what it looks like. For example, is it round and white, oblong and blue, tiny and yellow? Write the amount of medicine each pill or capsule contains. Write how often you're supposed to take the medicine. Write what time of day you're supposed to take it. For example, in the morning and evening if you're taking 2 daily. In the what is it for column, write the purpose of the medicine. Is it for your heart? Finally, in the last column, write yes or no for whether you're supposed to take the medicine with food or not. It would be a really good idea to take this sheet with you to your next appointment with your healthcare provider or when you see your pharmacist. Ask if the information is correct as you've written it. This gives you a great way of double-checking that you're in control of your medicines. Of course, you'll also want to follow through with the instructions so that the medicine can do its job properly. In Part 5, we'll explain how you can use a personalized action plan for controlling high blood pressure. An action plan is like a road map. It turns the decisions you make about what you want for yourself into practical steps for getting where you want to go. There's an action plan for high blood pressure handout that's available to you, and it looks like this. You'd begin using the plan by reading through each of the choices to see which ones might interest you most. The choices on the high blood pressure action plan are organized into sections including be active each day, always check with your healthcare provider before starting any new exercise program, take your blood pressure medications, skip the salt, cut back on alcohol, aim for a healthy weight, and quit smoking. The idea is to choose the action items that you want to do. You can also write in your own goals in the other section of the handout. You may be tempted to check off a lot of the boxes in the list, but it's better to start off with just 1 or 2. Lifestyle changes are made one step at a time. If you're overwhelmed with too many changes at once, you're less likely to reach your goals. You can always add more goals later as you continue making changes that move you towards the better and healthier life you want. When you're finished making your choice, there are 4 questions for you to ask yourself based on what you selected. You've already answered the first question, which is, what behavior would I like to change, based on which checkboxes you've selected. The second question to ask yourself is whether you believe that it's possible for you to do the things you've selected. Answer with a yes or no. The third question to ask yourself is, what must I do to achieve this change? Make sure that you identify a specific action that goes with what you want to change. For example, if you choose that you want to take the stairs instead of the elevator, decide how many times a day or week that means. Write your method for measuring whether you've reached your goal in the space provided on the action plan. Deciding how you'll measure your success is a very important part of this process. The fourth question is, when will I make these changes? Think about how long you think it'll take you to make this change in your life, then write the date for when that'll be in the space provided. The last step for creating your personalized action plan is to select your confidence level for making the change you've decided to make. To do this, select a number from 1 to 10 for how confident you feel that you'll follow your action plan. A confidence level of 10 would be the most confident, and a 1 would be the least confident. If your level of confidence is lower than 7, think about choosing something else on the action plan, or maybe giving yourself a little more time to make the change. There's one final handout that's available to you, and it's called High Blood Pressure, What You Need to Know. The handout has a summary of the key points from this video, and we hope it'll be useful to you. Thank you for your time and for participating in Getting Healthier Together.